All right. You should be able to see my PowerPoint. And we'll go ahead and get started. So as usual, if you are not with the Health Department or schools, we'll ask you to jump off the call and watch for it to be posted on our website later this week or early next week. Anything that should be shared with the rest of your staff, please do so, just to help with communication. And just a reminder, with the holiday coming up, we will not have a meeting on the 23rd of December or the 30th of December. All right, so first thing, last week, the state did make some updates to their guidance for managing exposures in schools. This is just a comparison of their graphics of the newer guidance compared to the older guidance. They just made some simplifications to the guidance, and their test to stay program was testing daily for the 7 days after exposure. Now they're suggesting every other day for 7 days after exposure. And then for unmasked exposures, rather than just automatically recommending quarantine, they have said that in addition to testing and mitigation strategy, or if additional testing and mitigation strategies, then their participation in school activities are at the discretion of the local health department. So as many of you know, I think end of September, we have been providing you additional guidance in those situations. I did update that last week, and we got that out to you on the 5th, I believe, or on Monday. I put last week, but now I just realized I think it was Monday because I did it over the weekend. So mainly the changes are just to help it to be in line with what the state is saying so that things are as compatible as possible. However, keeping what I previously provided in the past for you so that you have a lot more flexibility and options. So the differences are in our test to stay plan, the recommendation had been to test daily. I did put in there that you could test every other day if needed based on your resources and supplies. I did officially add in there that if you do elect to quarantine, you can either do 14 days, 10 days, or you could do a 7-day quarantine if you have a negative PCR or rapid antigen test that is performed on day 6 or 7. Previously, we did not have that in there, but we were allowing it because that was in the state's plan. I did add in a section that discusses athletic situations just in more detail and gives a bit more specific guidance for those situations. I did add a section that addresses situations where basically just an ask for schools that may not plan to follow masking after exposure or enforcing any quarantine recommendations or use the test to stay. So just some guidance to at least try to formally have parents screening students for symptoms regularly as at least a bare minimum. Again, that's not a recommendation to do that. It's just an ask if there's not going to be following of any other recommendations to at least do that. I did add in a symptom assessment sheet that can be used for those close contacts. So again, if that's the only thing that's being used, it's something that can be used. And then if you are following quarantine and they come back at 7 or 10 days, it's something parents can use for those remainder of days to follow for symptoms or with test to stay to help your parents follow for symptoms. I added in a graphic that helps you to count what days you need to test for the test to stay, because I know that gets a little confusing. I added in the graphic that we have that helps you to count quarantine days. And then I just updated the previous graphics. So these are the graphics that were in there. Like this one shows what to do when you have people that were vaccinated or had a prior illness of COVID within the last 90 days that are exposed. And the new one, I just highlighted the distances because that's really the difference there. And of note, after exposure to someone who's vaccinated or someone who's in quarantine, the CDC had changed the testing recommendation from 3 to 5 days after exposure to 5 to 7 days after exposure. They changed that several weeks ago. I had kept it at 3 to 5 days just because there had been so many changes right around that time already. I didn't want to cause a lot of confusion, but given that we're making changes now, I went ahead and put that change in there. So just so you know, so in here where it says get tested 5 to 7 days after exposure, that was changed from 3 to 5. This is an image illustrating recommendations to do if both the ill person and the exposed person is wearing a mask. Again, I highlighted the different distances. I added in that daily testing for the test to stay can be every day to daily to every other day. And again, changed the, for those that might go into quarantine or I'm sorry, watching for symptoms, to get tested at 5 to 7 days instead of 3 to 5. This is situations where one or the other person or both are not properly masked. Again, highlighted the distances and added in the 7-day quarantine option with a negative test. And for the test to stay program, added in daily or every other day testing. This is the symptom assessment sheet that you can give to parents that they can use then to track their student symptoms every day, should you like to use that. This is an image I put in there that helps you to count if you're doing daily testing. You know, if someone was last exposed on a Friday, really you'd only have to test them for 5 days. This is an example. If you were doing daily testing, but you know, the exposure was not discovered until, you know, later on. And then this is an example of using every other day testing. But I threw in there, you know, what if they had a sporting event on a Saturday, you know, you'd still test that day. So again, this is just giving some examples of how you actually count those 7 days of testing. It's the 7 days after they were last exposed, not actually 7 days of tests. And then this image we've used in other documents, but I put it into this because we've gotten questions about counting quarantine days in different situations. So I just wanted it to be handy for you. Now, with the test to stay program, obviously there's questions about test availability. Just a reminder, everything you need for acquiring tests and reporting tests and all of that is available on the state website. The link is here, but basically if you go to my.gov /coronavirus, I forgot to put /coronavirus there, I just realized that. If you go to the resource drop down, and then there'll be a tab right in this area that says K through 12 school opening guidance, and then you click on one that says the My Safe Schools testing program, and you'll get to this page. There was a call on Tuesday about testing. I was not on the call, but I did have the slides, so I'm sharing those with you. Again, I can't answer any questions about the call, but I had heard that a lot of people did not have the slides, so I wanted to share those. There is a new ordering link that's going to be live here soon. Apparently, from what I've heard, is that the school themselves, like the superintendent, will be ordering for each school rather than the ISD ordering for the district. They ask that you order a month at a time. The information on how to report, there is a really good informational slide set on the website I was just showing you previously. There is a backpack home test program where you can get home kits to send home with students should you feel comfortable utilizing those tests for the Test to Stay program. There is another link for that on that initial page I was showing you before. So if you have questions, their website is their email is the same. I'm just going to scroll back here. But again, this is the Backpack Home program. If you go to this here, testing collection and coordination team office hours, twice a week they have basically like a Zoom time office hours where you can call in with questions and things. So anything you have questions on the testing, you should be able to get through that site. So sorry about the scrolling here. Another document that I just got this week, apparently it was put together near the end of November and had not yet been shared with the health department, but it supposedly is going to be soon, but I got it for another reason. This will send along with the rest of the documents, but this is a summary from the Network of Public Health Law, which I've mentioned on calls before, but it is a fantastic summary of the legal authorities of schools to help protect students and staff against COVID. And so I know a lot of you have struggled and gotten questions and all kinds of issues with regards to this. This is just a really good summary because I'm not a legal expert and I've tried as much as I can to help with that. But this is finally a really good summary of what your authority is, how you have authority independent from us, and you don't need us to make you have authority. You have your own authority. So this gives you a really good summary. I'd encourage you to read it over. I'd encourage you to share it with your legal counsel so that they have it should there be any issues. The other thing I'm sharing, this was sent to us by Helen DeVos Children's Hospital to share or use however we want. I don't really know where else they've posted it. I can't really find it, but if you would like us to send it along, we can. But it's just an open letter that they sent out, really talking about the big increases in hospitalizations and ill children that they're seeing, just really encouraging people to wear masks indoors, to wear masks in schools, and to get vaccinated and get boosters. So again, if this is anything that you could find useful, I'm happy to send along the PDF, but I just wanted to share that with you today that is available. To see data, you can go to the mystartmap.info. Regarding our 5 to 18-year-old cases for our 19 counties, we had a little bit of an increase. We're starting to catch up from that gap in testing over the holidays. For our individual counties, this is Aranac, Clare, Gladwin, and again, the orange line is the numbers we had around this same exact week a year ago. And if you remember, we had the holiday surge, the winter surge was occurring this time last year. Isabella, Osceola, Roscommon, Clinton, Gratiot, Montcalm, Crawford, Lake, Kalkaska, Manistee, Mason, Mecosta, Masaki, Newaygo, Oceana, Wexford. Now, this week they did not put out one of their data and modeling updates from the state. I don't know if because they did it last week, over the holiday week, I don't know, but there just wasn't one. So I tried to pull together a couple of things here. Internationally, there's been at least 57 countries that have identified the Omicron variant within it. In the US now we have 21 states with it. It's pretty much just, we've all kind of accepted it's just gonna spread everywhere. We still don't know for sure what to expect from it. It likely is going to spread more easily than the original variant, but we really don't know if it's going to spread more easily than Delta. It must spread, or must be at least as hardy as Delta. Previously, there were other variants that Delta kind of kept suppressed because it was more virulent. But since the Omicron is having luck spreading, it obviously must be at least as contagious and hardy as Delta. We still don't really know if it's going to cause more severe illness, cause reinfections, cause more breakthrough infections. There still just is not enough data on that to know. It is expected that vaccines will help protect against infection, severe illness, hospitalizations, and deaths. We just don't know, if there's going to be a change. It's likely that there will be breakthrough infections. Again, we just don't know, how much. And some of our treatments, particularly like monoclonal antibodies, we're still waiting to know if there'll be a major change in how effective those are. So really, we just don't know a lot yet right now. But still, the best hope we have will be vaccination, boosters for those who are eligible. It's really our best hope that we have. This link, obviously, you can't really just copy that down, but when you get the slides, what I did is at the New York Times data site, you can make your own dashboard. And so I put the US, Michigan, and the 19 counties on this phone call together on that. And so you can go to that site if you would like to, and you can make your own dashboard too. It has similar data to the MyStart map. It's just a different way of looking at it. And you might just find it a little easier to use, or just, just another way to look at your data. So again, a reminder, just we won't have a call on the 23rd and 30th. And that is it for my slides. All right. So I'll get to my questions. If you have any questions, just put those in the chat. And at the end, we can take voice messages if you don't have access to the computer. So if you have a student who is a mask exempt, do they need to do a 10-day quarantine or test negative? So in the long document that I have written up, it's very detailed because I want to make sure it is clear for everything. If someone has a mask exemption or they're wearing a face shield, treat them as though they're not masked. It doesn't matter if they have an exemption, not masked is not masked. So if you're treating those individuals as, a test to stay or quarantine, if you don't have the facilities to test to stay, you would treat them just like anyone else who is not wearing a mask. Because, again, the risks are the same whether they have an exemption or not. If they're vaccinated, they don't have to quarantine. So if they have a mask exemption and they're vaccinated, obviously they don't need to quarantine. Is the test to stay apply to household exposures? No. So both the state program and our program, I didn't want to take up too much time to go through it all in detail. But if you read through the program, it's just for in-school exposures. The state program, I believe they only apply it, well, they used to only apply it to classroom exposures, but I think they've also gotten a bit more liberal. For us, it's really any school exposure. I do put a little discussion in there, you need to think about some exposures will be higher risk. And, you can always make your own judgment on that. But household exposures, and I do have a specific section that really goes into detail about household exposures, social exposures, out of school exposures, that those are just much higher risk, and they do need to quarantine for that. But we are allowing for the 7-day return if they have a negative test. for household exposures. So those are the only two questions I have in the chat right now. So feel free to unmute if you have other questions or type one in. But otherwise, I'll get the slides to you. We'll get the recording to you as usual. And I'll get the legal summary to you. And you should have been sent, or whoever your point of contact is for your school, should have been sent the revised modified quarantine guidance from us. If you didn't, it should be on our website in the school code section. And if you can't find it, anything, just feel free to contact the health department COVID point of contact, or you can contact me and we'll get that for you. And if you have any questions about it, just let me know. All right, one last ask for questions. And if not, we'll let you get out plenty early today. I'm sure you're all very busy. All right, guys. Well, have a great day and we'll see you next week.